Case 15, a really important case that address frequent issue on liver biopsy. It was a patient with cardiac amyloidosis, and a heart transplant was considered for this patient, but the liver was irregular on imaging and cirrhosis was suspected. So the clinician performed the biopsy to exclude diagnostic of cirrhosis, because diagnosis of cirrhosis would lead to transplantation of both liver and the heart. Really important case. So the core needle biopsy of this patient who will probably undergo heart transplant and has these liver abnormalities. So even at low magnification, you can begin to suspect a particular diagnosis, because you have here some areas that look dense, here also dense, maybe here dense, and some areas here, that looks clearer, and it seems to be due to a sinusoidal dilatation. So when you're used to this kind of samples, you may already have your diagnosis. You have here this dense area with thick trabeculae. It's a regenerative area. And here, an area with a little sinusoidal dilatation. You can see the lumens of the sinusoids. They are a little bit enlarged. Again here, and again here, a regenerative area with thick trabeculae. And the appearance was the same throughout the whole sample. Here, small portal tract with the regenerative area. You even have some maybe pseudoglandular formations here. They may occur when the liver is regenerative, meaning if you see some pseudoglandular formations, small ones in a regenerative area, it doesn't mean it's malignant. You have to be careful. And you have here the regenerative area around the portal tract, and here sinusoidal dilatation. So this is a case typical of what we call regenerative nodular hyperplasia. It's really a complex disease. We don't really know the molecular basis, the biology, and it may occur in really a wide variety of contexts, in patients with heart failure, after some medication, in patients who underwent treatment for hematological malignancies, and it may give to the liver dysmorphic appearance. It may give a little bit of portal hypertension, and often the clinician thinks, oh, maybe the patient has cirrhosis, but it's not a cirrhosis. There is no destruction, complete destruction of the parenchyma, and also it may regress if the etiological agent is removed. And it evolves very slowly to fibrosis. It's a very important entity to know, because it's not that rare. It may occur really in a wide variety of patients. And at first, it may seem complex to identify on biopsy, but the main findings are the regenerative areas around the portal tracts, and next, the areas with hepatocytic atrophia and sinusoidal dilatation.